Good day, my dear students. Welcome to Spotters in Pathology. The next couple of slides or spotters that I'm going to project shall be from acute leukemia. When I say acute leukemia, it can be acute myeloid leukemia or acute lymphoblastic leukemia. Both of these are important university theory questions which can again be asked in the Viva or in the form of charts or in the form of slides. So you people should be knowing. Also be careful. There can be questions when the examiner comes and asks you the differential count, etc. during your practicals. These are my sources of reference. This is important. Initially, I will be showing you the blast. Now, as I mentioned earlier, the neutrophilic series will be having the myeloblast, promyelocyte, myelocyte, metamyelocyte, staph form, and the mature neutrophil. In acute leukemia, the first letter is A. A means arrest, maturation arrest. So what we will be seeing is predominantly immature cells, particularly the myeloblast. Beyond the promyelocyte, we will not be able to see. So this is called as maturation arrest. And you will have to describe this cell. The cell is large. It has got a large nucleus. It has got prominent nucleoli. The nuclear cytoplasmic ratio, this is the nucleus, this is the cytoplasm. Therefore, the ratio is increased. And in the cytoplasm, I can see some inclusions, rod-shaped inclusions called R.A.T.S. So this is the scale. So 10 microns means it is almost going to 20 microns in diameter. So that will be important. This is a microphotographic picture which is showing almost the same thing. A large cell, abundant cytoplasm, large nucleus, increased nuclear cytoplasmic ratio, prominent nucleoli over here, and the R.A.T.S. These might be difficult for us, but in the exam, they will definitely focus it for you. And also in the chart, you will be getting a typical representative area. You need not bother about it. Now look at this. There are again large cells. I am not seeing the mature cells at all. Obviously, there is a maturation arrest. And the cells are all large, abundant cytoplasm, and there is an irregular or a convoluted nucleus. The cytoplasm has got some inclusions called the R.A.T.S. Nucleoli, these pale areas are the nucleoli. They are 2 to 5 in number. Promyelocytes may be seen. So these are the points. WBCs are markedly increased. This you should write when you get a slide or a chart. As usual, there can be a mild anemia and the platelets are decreased. Which leukemia the platelets will be increased? Chronic myeloid leukemia. So this is yet another one. This is from my text. I had shown it in the rapid revision in hematology also. So I am able to see large cells. Look at the convolution this particular nucleus is having. And these are the nucleoli. And this cell is showing a R.A.T.S. So these will be my references. I would like you people to kindly go back to them. The next spotter shall be the acute lymphoblastic leukemia. These again are the sources of references. Acute lymphoblastic leukemia, on the contrary, will occur in children. It can be children within 1 to 3 years of age or slightly older. The maximum age is about 17 to 18 years for a Burkitt's lymphoma or L3 counterpart. So in this one also, I'm able to see a large cell. Whenever I say large, you compare it with the RBC. RBC, all of us know it is about 7.5 to 8 microns. And this is nearly 3 times that. So it comes to nearly 20 microns. And it has got a large nucleus. The cytoplasm is relatively scanty when compared to the myeloblast. Nucleoli are here, but I'm finding it with difficulty. This pale area is a nucleolus. So it will be 1 to 2 in number. So WBCs are increased, mostly large cells. A few small cells are seen. And the cells are lymphocyte-like. Only thing they are ballooned and larger. Hyperchromatic nuclei, they are darker. Scanty cytoplasm. And nucleoli are 1 to 2. Not very prominent. These are the features. So this is the immature lymphoblast which are increased. I am not able to see the neutrophils, the eosinophils and other cells because the bone marrow is flooded and everything is being outpoured into the peripheral blood. Platelets are also reduced. Therefore, my diagnosis will be acute lymphoblastic leukemia. This particular comparison is important for your theory as well as for your viva. The examiner can ask you just to pull your legs. Why can't it be a myeloblast? Then you can rattle off the differences between a myeloblast and a lymphoblast. After all, both are university questions, both are charts for you, both are slides for you. Therefore, nothing is wrong if you people read this up. So I have shown you the importance over here, the cytochemistry, etc. They can ask you, how will you differentiate between a lymphoblast and a myeloblast? When you do a PAS stain, the lymphoblast will be taking up a block positivity of the PAS. For the other things, you can use the other stains such as PAS will be very granular, but you will be able to use the other stains in cytochemistry for a lymphoblast. So go back to R.A.T.S and then read them up. Also in my earlier classes, you would have seen the complete theory of all this. So be prepared for the university questions in the form of slides, charts, multiple choice questions also, as well as the viva. Thank you.